definitely more efficient because, people don't have to drive to an office and
Mhm.
go there. It's more cost effective, there's no overhead, and uh, you're able to see just a wider number of patients. I think it's definitely easier to scale when you work online. Much easier than in person, more cost effective and just more doable. Um, then, you can only squeeze a certain number of patients in the office versus online. And then, we're able to see patients in every state that I'm licensed in, which is a lot. If you're not licensed in a lot, it does limit the number of patients that you can see.
There's so much opportunity for AI applied to melanoma detection. First of all, we know that the skin is such a readily accessible organ to be photographed. And so there is just infinite opportunity for AI in photography to enhance early detection of melanoma. As we know, melanoma can be cured if it's caught at early stage, has a very, very high cure rate just with surgery alone. So it's a really important goal for the field of dermatology and for the field of AI to address melanoma detection. Over the past 10 years, there's been so much progress in terms of developing AI models for melanoma at lots of different stages. So, at very early stage, maybe even before patients reach a dermatologist, and also at later stages where we in dermatology have really high magnification photographs called dermoscopy photographs, which are taken at high magnification and with cross-polarized light, so very specialized. And the accuracy of state-of-the-art AI models for melanoma detection using dermoscopy images is very, very high. The thing that we're still missing is prospective trials in the intended use setting. So we know that AI models are very, very accurate when they're applied to a situation that they've been trained to do. And even with newer models, we know that even though the training isn't quite so supervised, the models will perform well where there is a lot of training data. But if your clinical practice setting is not exactly where public data sets are or other types of situations, you won't know how well the models perform. It, it depends on where in the process of diagnosing skin cancer you want to be. It could be a very early stage, just me and my cell phone taking a picture and sending it to a healthcare provider who performs the analysis and evaluates the lesion. Or it could be later on in the process where a dermatologist selects, just a certain number of suspicious lesions and takes more specialized photography. And, if you have a poor quality photo, I think all of us have taken a very blurry selfie and said, look at this great picture. And so we know that the model performance is going to be worse. The other thing that is really new that we've been working on with the International Skin Imaging Collaboration to advance the potential for AI models using total body photography. So that is modern specialized systems where they take a complete surface photo of the entire patient's body surface. And that has a lot of potential because when we think about a patient taking a picture of just one spot, they might not be thinking of the spot that is actually the spot of concern. And, there's been a lot of educational efforts towards patients self identifying skin cancers. But ultimately, there might be something on your back that you can't see. And so these types of approaches where they look at the whole body surface area try to say, can we perform triage on images that might not be as high quality as what you would take in your clinic of a specific lesion, but they are very good quality images of the whole surface. And can you try to say what are the highest risk lesions there? And so those are some of the types of experiments that we're doing uh, with our group. For skin cancer models, we know that most images that are available for training of these models are in certain populations. So most likely they'll be in high risk populations. So patients that have a higher likelihood of skin cancer than the population at large. It's most likely going to be in patients with lighter skin. And so we expect that models will perform worse in darker skin tones. And that's an area that we're really trying to rigorously study. And then another place where I think there is a sparsity of data is in pediatric populations. So we know that it's just not that common to take a picture of a suspicious skin lesion in a kid. Skin cancers are very uncommon in kids. And so we would expect, if you try to deploy these AI models in a pediatric clinic, they most likely would not work well. And those are the types of considerations. Those are just some examples. We also know that models can vary according to camera type, according to statistical distribution. So if you have a very high risk population or you have a very low risk population, the performance might be different. And anatomic site, there's lots of different things that can contribute to variability in model performance that you always have to keep in mind and that we have to hold AI model developers accountable to rigorously evaluating. I think there's really obvious examples of ways that AI models might improve our accuracy and maybe even reduce our biopsy rate of benign lesions while maintaining our melanoma detection performance. And that would be really cool. It would obviously lower costs in the healthcare system, but we really don't know yet because we need the right kind of rigorous trials. I think there's also a lot of hype around AI scribes and documentation and including in dermatology. And I think we really need, and I know there's a lot of trials being performed now to understand like, does it really reduce our documentation time? Does it actually increase the length of our notes and make it more difficult to take care of patients next time? And so we really one of the places where I think it's a big opportunity for dermatologists is to define what the outcomes really are that we think will benefit providers and patients and say, well, this is the outcome of interest for the next study. I really needed to look at this. Otherwise, I'm not sure that it's going to actually help me. And I think that's where we really need to go next. Kind of everywhere I look in derm, I think there's an opportunity for AI. I think improving skin cancer detection, both in early detection, finding skin cancers earlier, especially melanoma, and also in reducing benign biopsies so that we reduce morbidity from trying to really find melanomas earlier. I think there's a lot of opportunity for sort of day-to-day improvement on appointment triage, documentation, result management. I think we can learn a lot from other fields, reminders. I was going to follow up on that in 3 months. 3 months have passed, let's look at that again. Um, and so it's kind of like the sky's the limit. Outside, even though I mostly study skin cancer, I think outside of skin cancer, there's a lot of opportunity for AI with photography to be a biomarker to say, this is your severity of your disease at this time. This is how you're doing 6 weeks later. You're doing better. Great. Let's keep going with our treatment. You're doing worse. And there's starting to be some literature on, how photography can help you monitor cutaneous lymphomas over time and say, this disease is at this stage versus later and other types of diseases. So I think there's going to be a lot of automation in terms of how we look at skin disease in the future, even outside of just pure diagnosis, which for some inflammatory diseases might not be as hard for a clinician, but understanding exactly the extent of the disease might be something where AI can help us a lot. And I think that's going to have a lot of promise.